Welcome back. This is Dr. Saneja. This is the second eye of the patient I did Phaco for with the pre-existing pseudoexfoliation. And if you remember what happened during that surgery, I had posterior capsule tear, but managed to get a good vision after a careful manipulations. This is the second eye, which is the left eye with the macular scar. As you can see, it's almost similar to looking so similar to the first one I did. Well, everything, all the processes went well, and this time I convinced myself that I should be more careful, and which I did. So I took her to theater, and you will see how this one went. It's quite smooth, although the same things that I experienced were here, but I managed to maneuver that slowly as things went on. So, as usual, I put my port and then I started my surgery. Just to mention, this eye is a little bit sunken, and so access to the eye, especially the left eye, is a bit difficult compared to the first one I did. And the capsulorrhexis here, I try to use, you can see that, well, I'm managing slowly to do the capsulorrhexis, this time with, how do you call it, with forceps. Preferably, I use the needle capsulorrhexis. I maintain better AC with sustained viscoelastic. Situation like this, I prefer the capsule forceps. I have a better hand control and I'm able to manipulate better. Trying to do hydrodissection. This time, I think, just like the previous one, I was able to die after several attempts, but then the capsule looked more stable than the first one. So I started. This time, I decided to increase the power a little bit, and then the vacuum also a little bit. So I had a better grip this time. But still, you could see that it wasn't that smooth like the normal cataract switch would. So I'm doing here horizontal chop, which I do most of the time. But you can see that the first chop wasn't successful. So I went back again, and I think this time managed to crack it. This time you could see that I managed to dial to probably the reason why I could not dial the previous one was probably I did not hydrate well, most likely, but I can't tell. But this one was more smooth. I was able to bring the fragment to the AC much easier compared to the previous one. Although I was still very careful not to overstretch the zonal, so I was not that very aggressive. Yeah. So, but I was able to take the fragment one by one. I chop and then consume the, what do you call it, the Phaco at the same time. Okay. So slowly, and you can see that the mobility is much better compared to the other one. Slowly, as I progress, I've seen a lot of improvement in the mobility and the stability of the capsule as well. Well, I'm not sure whether this was much better in terms of the zonals. The other one may have more zonulopathy compared to this one. So within a very short time, as usual, I managed to remove all my fragments, and even the fallibility of the fragments were more responsive compared to the first case. Between, as usual, I will inject a viscoelastic. In between, I'll try to use this to rotate the cortex out of the bag and dislodge. Yeah, so it was much easier to pick And I think it was more responsive compared to the previous surgery, the previous one that I showcased, which was not really this fast. The whole procedure took about 15 minutes or so to be completed. As you can see, the peak nucleus was quite easy to be removed, unlike the previous case. So it went quite fast. There was no need for me to put a tension ring here. I was able to actually uh, do the surgery peacefully without any event. But remember, this is the eye that had a macular scar. So I wasn't expecting a 6/6 vision. That was the reason why I chose to do the right eye first. By the way, she was extremely happy after the first case. She came to my consultation room and said, Doctor, I can see heavens now. And that was one of the reasons why she forced me to do the second case, despite the complication I had in the first case. So here I was extremely careful, nothing go wrong. So I extended the incision slightly to avoid forceful injection, as that can also cause posterior capsule tear in these weak zones. And that was all. Vision improved to 618 with macular scar. That wasn't bad. Thanks. Thanks for watching, Dr. Senieja.